Well, the city's new policy to move homeless people off the streets and into hospitals, possibly involuntarily, is facing some tough criticism. The new policy directs police officers and street outreach workers to transport someone to the hospital for a psychiatric evaluation if they appear to be unable to meet their own basic needs.
But some mental health professionals are condemning the plan, arguing that it takes away a person's basic human rights. Advocates for the homeless say housing is the best solution for homelessness. Joining us this morning from City Hall with more on this policy, Mayor Eric Adams. Nice to have you back on Good Day New York.
Yes, thank you very much. Good to be back with you.
So, Mayor, how are you going to do this? Listen, we know we got a homeless problem. We know we have a mentally ill problem on the streets. We can't continue with status quo, not working. So how do you do this? I mean, you know that there are going to be some people who are going to resist this.
And that's not what we're finding when we're out on these subways and on the streets. We're finding to the contrary. First of all, this is not a police-driven plan. And I think some of the distortion that has come from the reporting is really unfair to New Yorkers. This is a small, specific group of people who can't take care of their basic needs, and they are mentally dealing with mental health illnesses to the extent that they are in danger to themselves and others. And so the goal is to zero in on them, give them the care and services they need. Don't wait until they do something that's harmful. If you observe this, we're saying as a city, we clarified the policy and the law, so we're not walking past people who fits this very specific group.
So, Mayor, how many people would you say are out there on the streets right now? And some of them are aggressive. They're not going to go voluntarily.
Well, you know, if someone is breaking the law, that's an entirely different set of standards and norms. If someone's breaking the law, if they're dealing with mental health illness or not, the mental health professionals are going to do their job as well as with our law enforcement personnel. If they're breaking the law, we have to do that.
How many people would you say are on the streets right now that need your help?
I cannot give you that number. I do not know. Every day there's such an evolving situation. It's a very complex situation. And what we are saying is that this administration is not simply going to leave an unclear policy out there. We're going to give very clear directions to our mental health professionals that are partnering with our law enforcement personnel when it's needed.
Well, I know you got a nod from the governor as she is going to be able to pay for 50 beds. That's being paid for by the state to start off with. And I know you're not saying you don't know how many people you might expect, but also will you guys keep track of the people that you are taking in for this help? Because that includes transparency. Because I know you don't have a plan yet for that, but I think a lot of people would like to know what you're dealing with numbers-wise month to month.
Well, you know, and that's very important what you said about the 50 beds. The 50 beds are for the group who must stay for over 100 days. I think it's close to 125 days. Those 50 beds are for a specific body of people. Those individuals coming to the hospital weren't on their medication, dealing with bipolar or some other issues that are extremely dangerous, you know, the doctors would make the decision. So what is happening, people are attempting to broad brush this entire approach. As we build out the system, build out the training, we wanted to send a very clear message to New Yorkers and our mental health professionals and our law enforcement officers. We're going to give clarity on what your authority allows you to do. And we're not going to violate any laws. We're going to stay within the boundary of the laws, but we do think we need to do some things in Albany to strengthen Kendra's laws and others.